Hi, my name's Jenny Bamford Perkins. I am a registered nurse and I hold a master's degree in nursing education. I work at Dorthea Dix, which is located in Bangor, Maine, and we serve patients with severe and persistent mental illness, ages 18 and older. At Dorthea Dix, I am the Director of Education. For the staff members, I'm responsible for 238 staff members to ensure that all education for standards, Joint Commission, CMS, and DHHS are completed. And then at times DDPC will have us do specific initiatives. When I'm asked why did I choose this profession, I kind of always have to giggle to myself about that because I'm not able to give an answer to that. I do not believe that I chose this profession. I believe that this profession chose me. I've just always known that I've wanted to be a nurse. My educational pathway to where I am today really had a lot of different curves and hills and mountains to it. When I originally graduated from high school, I, for some reason, started to become a social worker. And then I ended up not completing the program, became a CNA, and worked for a number of years as a CNA. From there, I ended up going and receiving my associate's degree in medical assisting and worked in family practice for a number of years and really enjoyed it, but found that I really did want to continue on to be a nurse. While at the same time, I was offered a job in a group home that I ended up working per diem in a group home in Bucksport with 8 clients where I became an MHRT1. And did that for a number of years, working per diem, and continued it until I finished my RN degree. What enjoys me about my job in particular in the behavioral health field is the one-to-one, that patient-centered care, being able to use therapeutic communication, assisting a person to empower themselves and know and believe that they are important. I think that's the most important part of my field, and just enjoying that time spent with people and learning their life story and assisting them during their journey that may not be absolutely perfect. Challenges that I face on a daily basis would be time management skills. There is so much that we're responsible for. You want to have that patient-centered care because that is our number one priority at all times. But then on the other hand, we have to make time for that documentation so that we're held accountable to the standards that we all must be at. If I'm asked about my number one experience, I think it was when I was working as a charge nurse on the floor at Dorthea Dix. And we were having a treatment plan meeting one day. And of course, the patient was there. And the discussions going on between the psychiatrists and the social workers and the other team members. And the patient made the statement that all she wanted was for people to look at her as an asset and not a burden. And I remember my eyes just beginning to well up. And I think when I walked out of that treatment team meeting that day, it really made me look at all of my patients differently in the aspect that they are an asset. We all are assets. None of us are burdens. Advice that I would give a person who may be interested in entering into the behavioral health field is just do it. Don't get caught up in anything you've heard about all the negative aspects of mental illness. Don't even think about the stigma. Just jump in, and regardless of what the position may be, whether it's a CNA, a social worker, a RN. Don't stop and believe that you're going to be boxed into this little box and you're not going to be able to do anything, because the reality is that growth and development is huge within this field. You can choose any door to open if that's what you want to do.